Hello, everybody. This is Dr. Dan Cartalicchio. I am your host for Suburban Wellness Group. We have a very special guest on today, Dr. Tabatha Barber. Dr. Barber, welcome. Thank you for being here. It is truly an honor and a pleasure to have you here.
Thank you so much for having me. I'm super excited for our conversation today.
So am I, and I'm going to read off your bio, and usually I give a larger, bigger introduction, but I just want to get right into it because, I want everybody to hear what you have to say. So Dr. Tabatha Barber has devoted her life to giving women a voice and a choice when it comes to their health and well-being. As a young girl, she struggled with self-esteem and identity issues, dealt with peer pressure, and survived the ridicule and stigma of becoming a teenage mother. As she shared in her first published book titled From White Trash to White Coat, The Birth of Catherine's Purpose, and we're going to go over this, those events led Dr. Tabatha to finding her purpose in life. With perseverance and grace, she was able to redirect her path in life and become a successful physician. I love that. Dr. Tabatha, double board certified Obstetrics and Gynecology, certified menopause practitioner through the North American Menopause Society. She also completed her training through the Cleveland Clinic's Institute for Functional Medicine. She cares for women one-on-one in her clinic as a functional gynecologist, and we're going to discuss that, and is creator and host of her own podcast, The Functional Gynecologist, where she shares her wisdom, knowledge with women everywhere to reclaim their health. Dr. Tabatha, thank you very much. Let's get it right into the first question. The birth of Catherine's purpose. Can you please share with us, if you can, and be so kind enough to share this time in your life leading up to writing this book, and what is Catherine's purpose?
Yeah, thank you so much. I think this book was the culmination of, a lifetime of struggles for me and finally figuring out my purpose in life. It's very much faith-based. The book is a work of fiction technically, but it's pretty much my life experience. My publishers just told me to fictionalize it for my own safety, right? But honestly, I had a rough childhood growing up in the sense that I felt lost. I didn't have a lot of guidance. I didn't like authority, and nobody could control me, quote unquote, my mom would say. But so I got into a lot of bad situations that I didn't belong in. And luckily, I was raised Catholic, and I had a strong belief that Jesus loved me and that he was always there. And so even in my darkest times, I would get completely lost and be in a situation like at a party or with a guy and just be thinking, I shouldn't be here. I'm better than this. This isn't right. So I always knew deep down secretly that I was better than that and meant for more, but I didn't know how to change that. And I got pregnant in high school, and that changed it for me. That opened my eyes, that cleared the path for me, because what I saw was I wasn't treated well as a teenager. I was on Medicaid. There was a stigma toward me, so I didn't get good health care. Nobody gave me informed consent, right? Like nobody talked to me about risks and benefits. They just put me on a pill. They just gave me a shot of whatever antibiotic or this and that. There was never any discussion about the birthing process or anything. I was just in these situations doing what I was told. And it was demoralizing. It was defeating. And once I grew through that, I realized women of all, economic backgrounds, races, colors, ages, need a voice and a choice. They need someone advocating for them. And I wanted to be that person. So it led me down the path to going back. I got my GED. I went to a community college. I kicked ass in my classes, and I got 4.0 for 2 years. And I transferred to Michigan State University with the just goal of becoming a doctor. So I went down that miserable path and it almost destroyed me, because becoming a doctor is one of the unhealthiest things that a human being can go through. You sacrifice yourself, body, mind, and spirit for strangers all day, every day. It's exhausting and it's depleting. And after 10 years practicing in obstetrics and gynecology, I had a back injury to the point where one night I couldn't even work. I couldn't move. I did the good thing. I had back surgery. I was a good patient for 6 weeks, even though it almost killed me. I did nothing. You know, I healed. I went back to work, and my third night on call, I re-injured. And I decided at that point that conventional medicine was not giving me the answers that I needed, and I need to heal myself. So I took 4 months off of work, and I went down this path, and I found functional medicine. And what I realized was this was all self-inflicted, right? I had a horrible lifestyle. I was stressed to the max. I was eating garbage. I wasn't dealing with my stuff because I was too busy taking care of everyone else, like the doctor I was supposed to be. I was setting a poor example for my patients, right? And I just flipped the switch. I just changed my life completely. And while I was off, I wrote my book, because forever people were like, how did you do it? How did you have the will to, you know, better yourself and go back and get your GED? How did you get through med school with a daughter? Like, they always thought it was so amazing, incredible, that I finally realized I need to figure out how I did that and share it with other people and inspire them to find their purpose and figure out how they can do it, right? So that is what birthed Catherine's purpose. And my message is just like, take control of your life and figure it out and do what you got to do, and know that God has your back, and you don't have to live in fear. You need to live in love and live out your purpose.
Oh, thank you for sharing that story, your personal share. It's something that's near and dear to me, as we were talking before we came on the air. You know, I grew up in Newark, New Jersey, a lot of social unrest, and my faith, I'm Catholic also, my faith has brought me through some very difficult times also. It seems like we've had a mirror image. You know, I'm this Italian American, you know, here in the Northeast, you're in the Midwest,
Yeah.
and yet it's still kind of the same story. And I was in the Holy Name Society last night, and you mentioned fear, and it is mentioned in the Bible more than anything else. Be not afraid. Do not fear, as I'm sure you very well know. I feel like we're kindred spirits, and we've been talking here for about 8 minutes, you know, doing this. So you just decided to turn your life around, and you wanted to be a physician, and you just that was the way it was going to be. And that's the way I felt also at some point in my life. And then you decided to go into obstetrics and gynecology, admittedly not the easiest specialties, right?
No,
and you were, go ahead, I'm sorry.
No, it was very rough. And, you know, I talk a lot about that in my book, about my residency and the training that was very demoralizing and exhausting. You know, you are trained to hold your bladder, skip meals, not sleep, do surgery in dangerous situations, because that makes you a better physician. And it's just, now that I'm out of it, I just can't believe that that's how it is. And
Right.
it's just not right. And I want people to realize that physicians are not superhuman. They are just like everybody else, and they need the same things to keep them going, because that kind of life is not sustainable. And, you know, in the functional medicine world, sometimes I get frustrated because conventional medicine is put down so harshly. It was birthed out of needing acute care, trying to save lives, trying to prevent infection and do surgeries to save people. It wasn't born out of treating these chronic lifestyle diseases that we've created. But because they can't handle that and they don't know how to deal with it, they get a lot of slack. And what I want people to realize is most physicians do mean well. Most physicians care. They are stuck in a super broken system that is very toxic. Like it's a malignant system, and you don't even realize it until you take a step back and remove yourself from it. So I feel for all my physician brothers and sisters, because there is a better way to live and to practice, and they don't even know about it because they're so engulfed in it. So give doctors some grace and keep praying that the system can change, right?
Right. And I really appreciate what you just said. It's, being a physician, you can take care of acute care, which is what it's supposed to be. So if you come in to the ER, I don't know, I chop my finger off, or, I have septicemia running through my system, and I had this is all acute. I'm going in and I need care. Right. And that's where, the ER department comes in, and that's where they live. And we have brought about chronic lifestyle diseases by diet and lifestyle. So you can talk about, cardiovascular disease, diabetes, autoimmune conditions, obesity, and so forth and so on. But I really love your passion helping out females in women's health. I love your passion. You decided to become an OBGYN. Now you're functional. What is a functional gynecologist?
So that's a great question, because I pretty much coined the term. I made it up because of the situation that I was in practicing traditional gynecology. And then I studied functional medicine, and I started incorporating all of these diet and lifestyle changes, getting to the root cause, healing the gut, worrying about your microbiome and in your gut, in your vagina, on your skin, all these in the mouth. And what I realized was that there's so many gynecological issues that can be treated functionally. So I guess I'm a functional gynecologist, and that's just where that was born. So I used to do 4 to 6 surgeries a week, right? Removing uteruses, or doing ablations, or removing endometriosis. Now I have more tools in my toolbox. With functional medicine, I'm decreasing inflammation and regulating periods with diet, with lifestyle, with optimizing your vitamin and nutrient status, with healing your gut, dysbiosis, all of these other tools that I didn't have before. And it's so rewarding. I haven't done a surgery in 8 months, and I'm still healing my patients. So that's pretty awesome.
That is awesome. And, in just hearing you talk, you're mentioning inflammation, you're mentioning gut dysbiosis. How does that relate to gynecological issues?
Yeah, so it might even be one of the most important things to keep your hormones balanced, namely because estrogen gets metabolized through our liver and gets excreted for us to remove through our stool, right? But so many women struggle with constipation or gut dysbiosis, meaning the bacteria living in their gut is imbalanced. They might have yeast overgrowth or bad bacteria. And these estrogens that we're trying to get rid of are getting recirculated back into our system because of that altered bacterial status, and causing too much estrogen, which is a huge issue for women in their, early 40s, early 50s, that whole decade. And so that can lead to all kinds of imbalance, and it can be significantly improved with something as simple as realizing that you can't eat dairy. And when you stop and you start eating more vegetables and you're pooping every day, hey, your estrogen isn't out of control anymore. So sometimes it's as simple as that. Sometimes it's a lot more complicated, but gut health is super important.
Yes, it is. And you and I, we're dealing with that, daily
Yeah.
in our practices where the immune system is sitting in that gut. We're
Yeah.
talking about a leaky gut type of a situation. Can you explain to the audience what a leaky gut is?
Yeah. So I like to tell my patients, there's a tube where your food's being digested and trying to be removed after that. And between that and the blood system, there is one layer of cells lining your gut, and they have all these little tight junctions in between the cells that act like toll booths. They're trying to decide who's going through small little amino acids, fatty acids, vitamins, things we need. But if those gap junctions are destroyed, you're going to let in bad stuff that your immune system is right there and ready to respond. 75% of our immune system is at that front line, and they're going to attack. And once you turn on your immune system and start attacking that, if you have the genetic propensity for autoimmune disease, that can get turned on. And once that's turned on, it's really hard to stop it, right? So it's what breaks these gap junctions. Things that women use all the time: birth control pills, Motrin and ibuprofen for their period pains and their joint pains and their headaches, steroids, antibiotics. How often did I give antibiotics as a conventional doctor for bacterial vaginosis, things like that, like all the time? All of these things, or even hormonal shifts in life, pregnancy, menopause, they break those gap junctions. And if that is continued on, things are going to leak through. Your immune system's going to react. You might even go on to develop autoimmune disease. But nothing less, you're building this systemic inflammation. We all know where that goes, right?
Right, that goes to that chronic lifestyle disease. And we have a lecture that we do in our office. My partner is an integrative internist, and we talk about estrogen dominance, that phrase. And you were going down that line. Could you give us a little bit more of a definitive definition? What is estrogen dominance, and some of the other causes that we can have?
So it can be two main reasons. One is that you physically do have too much estrogen for your age that you're making and recirculating. And like I said, it's a lot of times from the gut dysbiosis. Or you can have low progesterone, which makes it seem like you have too much estrogen. And that comes down, number one reason, stress. Chronic stress, like you are living with your plate way over full. You are running from thing to thing. You're never stopping to process your day, take a deep breath. You're eating on the run. You're ignoring your marital issues, right? Like all of these things are producing chronic cortisol production just all day long. And what is cortisol made from? It's made from progesterone. And so every time you are making that, you're stealing your lovely progesterone that's needed to balance estrogen. Progesterone's like our feel-good hormone. Balance, keep us nice, let us sleep, let us deal with stuff. If we got too much estrogen, we're irritable, we're quick to anger, and then we have heavy, crazy periods, painful periods that feeds endometriosis and fibroids. And so you get this picture that I see literally every day in my office, right? My periods are ridiculous. Or they come in, my periods were horrible. I had an ablation, but I want to divorce my husband. I can't sleep. I've gained 20 pounds. It's like, yeah, you had the ablation, which got rid of the bleeding symptom, but you still have excess estrogen circulating. You still have the root problem. So we didn't fix the cause. And so estrogen dominance can really affect women's lives and kind of push them over the edge a lot of times.
Sure. And I have here, chronic stress was my first question that I was going to ask you. I can cross that off now because I knew that you were going to go there. And we talk about, in our lecture that we do in the office, we talk about personal care products that could be a problem. Can you comment on that, Dr. Tabatha, please?
Yeah, so a lot of the chemicals that we've produced in the last, I don't know, 70 years or whatever that man has created, they act like estrogens in our body. And so plastics are the biggest one.
EPA.
Yeah, so you're drinking your water, trying to be a good girl, getting enough water in every day. But if you're leaving that plastic water bottle in your car, it's heating up. You are drinking the BPA, you're drinking those chemicals, and your body, they bind to receptors in your body and stimulate an estrogen response. Same thing with like Glade plugins. I shouldn't name names, but like air fresheners, all those chemical fragrances that you see in products, those all stimulate your estrogen receptors. And then you add on to that the milk sources or the dairy sources of hormones. You know, we're seeing girls hit puberty a lot younger these days, and it's all because of what they're being exposed to in the environment that's making this fake estrogen seem like, oh, you're going into puberty, okay, let's do this. But really it's not your real estrogen, but it acts like that. So it's super important that you really work to try and decrease your exposure to those. And you know, I realize it's a big deal to go through and change all your cleaning products, your cosmetics and personal care products. But if you do one thing a week, it will add up. It honestly will. Like, get a stainless steel water bottle, throw out your plastic Tupperware, don't heat your food in plastic, for goodness sake. You know, stuff like that.
And I love what you just said. If you can accomplish one of those goals per week, over a whole year, you've made 52 significant changes.
Yeah.
Something as simple as water in a glass, you know, so that you're not drinking that BPA, because even in the cold weather, I was reading a study not too long ago, there's still that chemical reaction and you're still drinking in that BPA.
Well, yeah, think about Starbucks. People who get Starbucks every day, as soon as that hot coffee hits that plastic lid, you're drinking those chemicals. Like, I love Starbucks too, but I just want you to be aware of what you're doing to your body potentially.
Right. We spoke about personal care products, BPA, gut dysbiosis. What about heavy metals in the environment? How does that come into play?
Oh, yeah, heavy metals. So that's very elusive because we think, not us, that couldn't possibly be us. We live, you know, in a nice town, the water's filtered or whatever. Or people have white fillings now. They got rid of their silver fillings. But silver fillings have mercury, and even if you had them removed, when they got removed, that mercury vapor can go up to your brain and just set up shop. You know, those heavy metals live deep in your tissues. They're not floating around in your bloodstream that you can easily just go get checked for. They like to hide out. And once you reach a point of no return, I call it, so like your toxic burden, you accumulate stuff all through your life, but then you get to a point where all of a sudden it's too much and your bucket's filling over and you're having symptoms. It could be because you've accumulated enough toxins to finally be affected. I mean, we all handle some, right? But some people get to that point of no return. And I think we have a lot more lead in our water than we realize. We have lead in our cosmetics. Yeah, I mean, they did a study that was like 20 out of 33 lipsticks had lead in them. You know, makeup is constantly being recalled for arsenic levels that are too high. So, I mean, all of these things accumulate and add up and cause dysfunction. And the biggest thing I see is they zap your energy. You know, we have these amazing things called mitochondria in all of our cells. You know this. There are powerhouses. They make our energy. They keep us going. But those mitochondria can't make ATP or energy and shoot it out of the cell if our cells are full of toxins. So your energy is zapped. You just can't do what you used to do anymore. You have brain fog, you know, you can't get rid of your weight. And another amazing thing is that, you know, studies now are finding fat cells actually our protective mechanism to hold some of the toxins that we're
Yes.
being exposed to, right? So we're getting full of these pesticides and plastics, and our body doesn't want to put it in our liver, our brain, or our kidneys, so it stores it in our fat cells, and it's trying to protect us. And we can't lose the weight because your body's like, oh no, where else are we going to put this? So you get rid of those toxins and you can finally lose weight. So
Right. Once those toxins are and those heavy metals are within the fat cells, it's very difficult to get rid of them. Not impossible. And when patients come in and they need to lose weight, they may lose some inflammation or water, but they're not losing percent body fat a lot. And they can go on these fad diets. They're calorically restricted and so forth, but they're not getting rid of the toxins, which prohibits them from getting rid of that percent body fat. Let's talk a little bit about obesity when it comes to estrogen dominance.
yeah.
What's the relationship there?
So again, back to the fat cells. Our fat cells actually make estrogen, a type called estrone. So you think they're just annoying and you want to get rid of them, but they can actually be a cause of increasing your risk of breast and uterine cancer because of this bad estrogen that they make. So our bodies have three types of estrogen: this estrone, estradiol, which is our nice reproductive, good balancing estrogen, and then estriol, which is weaker, it helps more vaginal tissue, that type of thing. Estradiol, the good stuff, can be made into estrone, which is common, and that's fine as long as it gets methylated and kicked out of the liver and sent on its way. But sometimes that doesn't happen, and it gets sent down the wrong pathway and can cause DNA damage and increase your risk of breast cancer. But fat cells straight away make this type of estrogen. So if you are carrying extra weight, you're constantly pumping out the estrone and increasing your risk of getting breast cancer and uterine cancer. So I commonly see women who are overweight have a smoother menopausal transition, less symptoms, and I think that it's because they have this other estrogen kind of acting as a replacement as they're going through their estrogen deficiency. That might be nice for symptoms, but it's not nice for your health risk in the future. So I personally do the Dutch test often on women, which is a dried urine for comprehensive hormones, because it can show you those three types of estrogens and what they're being metabolized into. And some women, we've caught some really concerning elevated risk for developing breast cancer. And, women think that it's all about their genetics, and it's really not. I mean, genes are just genes. Whether or not we turn them on and make them do bad things is partly up to us, right?
Right. 100%. Now, you were talking about some of the symptoms of estrogen dominance. What are some other symptoms that a woman may experience?
So what I see is the heavy periods coming more frequently, usually down to every 3 weeks, lasting longer. She's feeling super irritable. She's having bad headaches before the period because the drop in estrogen right before is dropping from such a higher level than it normally would be. So it's more dramatic. So a lot of PMS stuff. And that can go on for years and years.
Yes, and I've seen that. I've seen that in my office, and I'm thinking of one particular patient who, just before their cycle, they would drink a ton of caffeine, and that would really just be a cause set in motion. So, how does something like caffeine adversely affect this whole estrogen dominance?
So, caffeine's a stimulant for sure, and caffeine is metabolized through the liver, and so you're using kind of the same detoxification pathways as estrogen for sure. And then you'd look at some women have gallbladder dysfunction, especially the overweight women who are struggling with their weight. your gallbladder is not functioning well. So sometimes caffeine is actually good for that because it can stimulate your gallbladder to function better. But if you're full of sludge or stones, it might make it worse. And that's going to increase your estrogen as well, because you need bile to excrete things. And if your gallbladder is not functioning well, that whole system's going to be messed up. So, you know, genetics is cool in that some women have the enzymes to break down caffeine really quickly and they handle it great, and some women don't have that enzyme and they do very poorly. So I think that's where functional medicine shines, is getting down to the individual and what is best for them in their situation. So for women, I suggest doing a food diary for like 3 to 5 days along with your symptoms to see what you can correlate, you know, and then through a whole month cycle if you're still cycling, because I think, you know, we don't give the cycle enough credit. Honestly, the first 12 days or so of your cycle, you should feel amazing and have lots of energy. If your estrogen's balanced, you should be getting all your tasks done, like feeling like doing good, healthy workouts. And then after you ovulate, you should be more in like rest and repair and restore mode and feeling loving and like doing more creative down low key things, you know, and then have your period. But we try to just go the whole month long. And then we get frustrated that, you know, we're not at 100%, you know, right before our period or something, but we're not respecting the cycle that we live in. So it's complicated. And I think each woman should look at their individual situation and really try to maximize what works for them.
I think that's important, because of us functional medicine practitioners, that's where we live, and that's how we get our great results. And you mentioned diet diary, simple yet very powerful, right? Very powerful. Let's talk about foods now when it comes to estrogen dominance. I think that's important too, because as functional medicine practitioners, you know, we make recommendations, and diet is big. It's, you know, 1, 2, or 3 on the list. What are some foods that have a lot of insecticides, pesticides that we should be avoiding, and what's that relationship with that estrogen dominance?
Well, I would definitely say you could, you know, you go by the environmental working groups, clean 15, dirty dozen list they put out every year. That's helpful. If you can't always find organic or pay for organic, then at least try to follow that list, because they will tell you which ones are the most harmful this season or whatnot. But what I always find is people realize they should eat organically when it comes to fruit and vegetables, but they don't really pay attention to the stuff in the boxes, like their pasta and their cereal and their breads and their crackers. All that is the most pesticide laden food there is, you know, flour and corn and soy. And so that is where you should really be focused on getting organic, because that accumulates very quickly, the amounts that we eat, especially in our children. Like, so many kids eat boxed cereal, and you can just load up on the pesticides all day long with Cheerios. So super important. Try to go organic. I would say my favorite go-to is cruciferous vegetables for women. You know, it's full of indole 3-carbinol, which is like helps you metabolize your estrogen. So it's a natural way for your body to get rid of excess estrogen. You want to eat broccoli, cauliflower, kale, Brussels sprouts, chard. All of these things naturally get rid of your estrogen for you. So it's amazing. You can buy it in a capsule form called DIM, or diindolylmethane. And for a lot of women, that's my starting point. I put them on DIM to decrease their estrogen excess. You can also eat these vegetables, right? So I think that's a great starting place. And not only about what to eat, but when or when not to. Like, I'm a huge proponent of intermittent fasting. You need to give your body a
Yes.
rest. You cannot be
Yes.
taxing that pancreas and that gut and that liver constantly, right? You need to get freedom with fasting. And so I'm a huge proponent of at least going, 12, 14 hours some days without eating. It's okay. That's how we were made. God created us to be able to go without having a grocery store and a fast food restaurant every 5 minutes.
Oh, and that is so important. And just to go back to corn and soy, let me throw wheat in there.
Yes.
And there was that 2016 article, I think it was New England Journal of Medicine, where 54% of Americans eat corn, wheat, and soy as that filler. And 25% of that 54% have health conditions that consume most of that stuff. And that we want to take away as much as we possibly can. And intermittent fasting, I do this also. It's a great tool. What other tools do you have, such as a diet? What would you recommend as a diet for somebody that has estrogen dominance?
So I like to try and, eat according to your cycle. So if you are still having periods and they're heavy with estrogen dominance, or you had a hysterectomy or ablation, but you still are circulating too much estrogen, I like to focus on the healthy fats so that you can make more progesterone naturally while you're decreasing your stress. Getting enough protein. I think women in their 40s need to quit doing so much cardio, and they need to focus on strength training and working on their muscles. So they need adequate protein, and then just heavy on the vegetables, because fiber is what's going to get you pooping and get that estrogen out of there. So I don't want you getting fiber from wheat bread or wheat products. I think, like we mentioned, pesticides kill those little gap junctions between all the cells in your intestines. So if you want to continue to have a leaky gut, keep eating pesticides. So I would say really focus on the vegetables, the healthy fibers, the healthy fats. I like to make sure it's a balance of healthy fiber, fat, and protein with every meal. You can't be like super off balance, I had a patient recently, thought she was doing an amazing job because she was just eating this huge thing of sweet potatoes for breakfast. And she's like, I just don't know what to do, because at 11 a.m. I'm like shaky and angry and so hungry. And I'm like, that's because all you ate was sugar. I get it. It's healthy, but it all gets broken down into sugar. You need fats and protein to balance that and satiate you and keep you going. So I don't think that we're balanced enough in our food. And I don't want to villainize any of the macros, right? I don't agree that we should completely get rid of carbohydrates, or, the low fat of the 90s, that really ruined us, that diet. We need fats to make our hormones. Cholesterol is the backbone of all of our sex hormones. So I don't want to villainize anything. And I don't think one diet is right for everybody.
Right.
Because some people have autoimmune issues. Like, I personally cannot eat gluten, or I'm wrecked for the next 3 days. I have Hashimoto's. So what I eat has to be different than what my sister eats. And, so you have to figure that out for you. But you got to be smart about it.
Yeah, and for you, your conventional medical treatment, then you have the functional treatment. Compare and contrast those two. What is it? What is it for the conventional treatment that you do? You spoke a little bit about diet. Is there anything else on the functional end?
Well, when I only did my traditional obstetrics and gynecology, I would tell people they needed to lose weight. I would tell them they needed to eat better, but I didn't have any ideas for them. I didn't have any solutions or tools, right? So I would send them to a traditional dietitian, and they would get the food pyramid from the FDA, which was totally jacked up, and they wouldn't get any results. nobody would get better. So having the tools of understanding how the different diets nourish you and replenish you and, you know, work with certain diseases has been super life-changing for my patients. Like now I have tools for them that I can really get them results, you know. And I forgot your question. I'm sorry.
That's okay. I mean, we are jamming here. I could probably go another 5 hours. You know, compare and contrast conventional, the medical treatment with your functional. Do you still do some conventional treatment?
Yeah, just for like gynecology. So I would say that, you know, conventional medicine is very much like, we're going to fix the symptoms for you. What are your complaints? Here, it's either a pill, which is almost always a birth control pill, or a synthetic hormone replacement, or surgery, some kind of procedure. And, you know, I rarely do any of that anymore. You know, what I do now is let's start by vastly shifting what you're eating, how you're managing your stress, how you're moving your body every day. I think that gets completely neglected. And then working on the deeper inner stuff after you heal your gut, do all that stuff we've already talked about. Work on the inner you, because what I find is women in their 40s have done for everyone else for like the past 20 years. They've taken care of their children and their husbands and their businesses and their careers, and they've completely neglected themselves, and many to the point where they don't even feel like they have a purpose and they don't know why they're here. And so that all needs to get dealt with. You're not going to heal and get better until you figure all that out. And so it does take a lot of work. You got to start to be mindful. You got to learn the word no.
Very difficult at times.
It is, but you have to realize when you say yes to everything, you're saying no to yourself. You're saying no to things that you probably care about even more. So you got to get a backbone. You got to say no, it's okay, and start taking care of yourself. So I think that is much more successful and sustainable in the long term for women, rather than just cutting out their uterus or giving them a birth control pill. When I did that on a regular basis, they came back constantly, because it was never a solution. It never fixed the root cause. It was always a Band-Aid.
So what should a woman do to reclaim their health? We spoke about mindful, saying no, a little bit about diet. What else? What do you recommend in your office? Do you have something that you hand out, a pamphlet? What, you know, when you get that patient in and you're saying, okay, I want you to reclaim your health, what is it that you say to them?
Yeah, I am always going through the same 6 things in my head. We have to heal your gut. We have to get your sleep dialed in. We have to get you moving your body regularly. We have to get you nourishing your body with food instead of just filling you up because you're hungry, actually giving your body what it needs to function nutrition wise, right? And then dealing with that deeper spiritual purpose. So I am always working on those 6 areas in one way or another with women. And I find that that is where the success lies. That's where the magic happens, is dealing with all 6 things. Because if you don't deal with everything, you're never going to be balanced, right? And so I like to think of their cycle as a vital sign. It's a window into what's going on. If you're coming in complaining about cycle issues, we got work to do. Once we get your cycle dialed in, I promise everything else is gonna be falling into place, because that's just a window into what's going on. So that's all the stuff we work on.
You know, and I love that. And we haven't spoken about sleep, because one of the questions I ask is, do you get that deep restorative sleep? Are you in REM at any point in time? because that, it helps balance your body out
Yeah.
when you're out that.
Have a patient say yes.
Rarely. And here in the Northeast, everybody's go, 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 go. And I get those CEOs that come into my office, and they're type AAA personality, and they're sleeping 2 to 3 hours a night. And I was like that too at one time. And it's very difficult to deal with them. And if it's a male or a female, everything is just way out of balance. Everything is just whacked out. And sleep, everybody out there, it is extremely, extremely important.
Yeah.
So, yes.
When people say, "Oh, I'll sleep when I die," my response is, "Well, you'll be dying a lot sooner than I will, so go ahead."
You may be dead now, and you are among the living dead at that particular juncture.
Exactly.
Is there anything else that you want to communicate to our listeners today about estrogen dominance? Is there something that you think we missed that you want to discuss?
Oh. Gosh,
That's always that open-ended question, Dr. Tabatha.
I feel like we really hit it all, but I do want to make the point, like, women need to know that they are worth their time, because I just am tired of hearing women say they don't have time to take care of themselves. And I think it's because there's a deeper issue of not feeling worthy that stems from, what society has trained us to think and believe as women. And we need to realize that in order to take care of the people we love long term, we do need to take care of ourselves, just like the adage in the airplane, right? You have to put on your oxygen mask before you put it on others. So you have to take care of yourself. If you expect to keep showing up for people and being your best self, you have to give to yourself.
I love that. And I think that all of your patients are very fortunate to have somebody to have you, because you are your passion and your knowledge comes through significantly. And I even feel comfortable coming to see you. So I'm going to fly out.
I will be your gynecologist.
It's funny because I have had multiple OBGYN in my podcast, and we speak about female issues, and they always say the same thing when they get off. Oh, you were okay, you can handle it. I say, well, we're doctors. I mean, that's just the way it is,
Yeah.
So how can people contact you? If somebody wants to become your patient, if somebody wants to consult with you, how can they contact you, Dr. Tabatha?
Oh, definitely. You can find me on Instagram and Facebook at Dr. Tabatha. It's Tabatha, no I's. And then my website, www.drtabatha.com. Just send me a message. Reach out to me. I will respond. And then check out my Functional Gynecologist podcast.
I totally agree. You know what? I recommend Dr. Tabatha. If anybody wants to call her, you can contact me. You can contact Dr. Tabatha directly. We're over an hour at this point, and I could probably go on for another hour or two.
I know. We didn't even talk about the juicy stuff, right?
You know what? Dr. Tabatha, we're going to have you on again in a couple of months, and we'll pick another topic. And we're going to go and we're going to discuss.
Awesome.
And we're going to discuss and we're going to educate, motivate, and inspire. I can tell you, this is, and I mean this, very special person, written a book, went through what she went through as a teenager, adolescent, and then becomes a physician and is so passionate for what she is doing and how she's helping out women change their lives. It is truly, truly an honor and a pleasure to have you here, Dr. Tabatha. Blessed to have you. Thank you very much for being here.
Thank you so much, and blessed to everybody.
Yes, absolutely. Want to thank everybody for listening in. We'll have Dr. Tabatha on again. Until the next time, keep going. Take care now. Bye-bye.